your dosages have to be changed. Like we were talking earlier, you know, the military hands out 800 milligrams of ibuprofen for everything. For an older adult, you're probably not going to be giving any more than 200 and get the same effect.
How do they determine that?
Pardon?
How do they determine, like, what the dose?
Oh, some old people got that problem, and then they started, they realized, okay, we have an issue.
I mean, like, half the dose, how would they determine for an older person?
What they're able to tolerate. Generally what happens with dosages is that they start with a lower dose, and then they build up.
So they do like...
So they might give an older person 50 to 100 and see if they get an effect. They don't. You give 200, they get an effect, they don't have all the side effects, that's ideal.
So they don't do like the graph?
No.
Just the side effects from the medication?
Correct, we'll be covering that in the part I would say my mother sent me this, but I saw her this weekend, so she gave it to me. My sister is a tech support person for she has all the time. So we have disease-modifying anti-rheumatic medications like gold therapy, which is still used, not as often as it used to be. We have immunosuppressive agents because we know that rheumatoid arthritis is an autoimmune problem. We have immunomodulators, and then we also have anti-malarials, which have nothing to do with it. Gold therapy. Basically, it does all this, and it does a fairly good job of it, but it tends to be a little harsh on the kidney. The patient will go in every 3 to 4 months, and the doctor will have an injection of gold. Not gold plating, but gold, actual 24-karat gold will go into this person's butt. What happens is that gold is a heavy metal, and then it precipitates down into the joints and helps to prevent that solidifying of the synovial fluids between the joints. What happens in rheumatoid arthritis is that you have fluid in a force between your joints, which help your joints to move quite freely. In rheumatoid arthritis, not only are the joints themselves getting destroyed, but the fluid in that joint is now becoming like jello and becomes thicker and thicker over time. Well, what the gold does is it helps keep that solidified as much as possible by releasing your leukocyte migration, going down into the fluid itself and trying to break up all the components thereof, and then your prostaglandins. It stops the progression of the joint degeneration. It is a very painful shot. The people who have it, generally, nothing else has worked up to that point. This is what they need in order to continue their, to be able to use their joints with rheumatoid arthritis. A lot of times it doesn't work.
Does it?
Yes, ma'am, it doesn't.
Oh, so you get gold.
But you do it anyway. Why? Because we can.
Yeah, because it's a metal, it only affects joints in the lower portion of the body.
It actually goes to joints on other parts of the body also. Which you would think with gravity and so forth, it would do that, but in circulation, it tends to go out within the other joints as well. The issue is that which doesn't now is circulating through the blood, and the body has to get rid of it. Some of them have to come out through the kidney, and now you have something bigger than what the kidney can handle, and that destroys nephrons and so forth as it's trying to excrete gold. Or it's clogging up your glomerulus, where you have your filtration and so forth. We have an increase of liver enzymes, which means that we are affecting the liver as well. Medications can have some pretty severe side effects, but you look at, does the benefit outweigh the side effect? If it does, let's use it. If it doesn't, we don't use it. Okay? That's the rule of thumb. Not every physician follows that, but that's the rule of thumb. Contraindication, since it's filtered through the kidneys and filtered through the kidney, it also goes through the liver. Since circulation passes all through the liver, we have these issues. That gold will come out and then will affect whatever blood system it's going into. Systemic lupus. Have you heard of lupus? You know what that is?
No.
Okay, really simple. What it is that it's a thickening of all the organs in your body. It's also an autoimmune disease. Also an autoimmune disease. But it causes thickening, so your liver gets thick, your lungs get thick, your heart gets thick, and you eventually just die. You'll learn about it more, but generally lupus starts somewhere in your early 30s.
What exactly do you die
Lupus itself, cardiac failure.
from? Like the frustrated?
Yeah, and you'll get that. Get me to the next slide, says first. Okay. No, we don't. All right. 20 minutes till. Once you come back at 5 minutes till, and then we'll continue with this.